And so what I'm going to talk about today really was made possible by a number of conversations with Dr. Young over many years, where she continued to encourage me and Dr. Tanzi and then Dr. Friccione that we were on the right track. And with the support of visionary philanthropists, including the Colemans, we were able to launch. And that's the story here. And what I'm going to tell you about now, as I share the slides, is a little bit about our vision for brain care and what we think you can do right now to really thrive in place by taking good care of your brain. So let's see, are you not yet? How's that? Are you seeing the slides?
Yes.
Okay.
We are now, yes.
Okay. So the brain health crisis really is the crisis of our time. I think you've got the climate crisis. We have a crisis of global poverty. And then we have the crisis of brain health. And what that means is that we have an enormous burden of age-related brain disease that we are managing. So just to give you a few figures, 2.9 million people in the US had Alzheimer's or related dementia in 2017. Today, every 4 minutes, someone dies of a stroke. Put another way, today, 1 in 10 over the age of 65 have dementia, and it's more common in women than men. An estimated 21 million adults in the US have had at least one major depressive episode, and that figure is likely to have gone up in the pandemic. And then finally, we're projecting an increase in the global burden of dementia and Alzheimer's to at least by 2060, 9.5 million in the US alone. So the challenge here is we know what's coming. Let's do something about it. So 5 years ago, Doctors Tanzi, Friccione, and myself got together, and we were launched by a visionary philanthropist, Henry McCance, and his family. And crucially, important support from our advisory board of individuals, none of whom are doctors, very important. They're all in business or in public health or in economics. And then, of course, the steadfast support of the leadership of the hospital, chief of neurology, chief of psychiatry, and the vice president for neurosciences. With that support, we've been able to take forward a vision for having an impact on the brain health crisis in not very long. So our goal is to prevent brain disease, and to put it very succinctly, we want to reduce the number of dementia, stroke, and depression cases by 10% in the next decade, and then 30% by 2050. So we have an ambitious goal, and we think we can accomplish it both because we think the knowledge is already there to achieve a portion of this goal, and we're rapidly generating the knowledge to achieve the rest of it. Why are we confident? Well, look what's happened to heart disease over the past several decades. Here on the graph, you see decades from 1970 through 2020, and this is the number of heart disease deaths per year. And look at that drop. There were 800,000 deaths in 1969, and by 2020, that figure was closer to 200,000. It's a remarkable drop. So how was that achieved? Well, part of it was a lot of innovation in the treatment of heart attacks, but a major part of it, major contributor, was everything that was learned about how to prevent heart disease, and how that learning was then integrated into your regular routine primary care. So our focus is to do the same for the brain. We've got to make primary prevention of brain disease in primary care the mode through which we achieve our goal of preventing Alzheimer's, dementia, and stroke. So just think about this. Right now, in many cases, we can measure your risk of developing brain disease as early as 30 years before you ever have any clues to a diagnosis. You ever start to have any memory problems, or you start to have difficulty moving an arm or a leg. But there is no routine approach to brain health in primary care. We do a great job of heart health monitoring. We do a great job of cancer prevention. In fact, the bulk of primary care is devoted to managing whatever conditions you have, and then preventing heart disease and preventing cancer. But if you think about how we take care of the brain in the current setup, it's largely the domain of specialists, neurologists, psychiatrists, psychologists, and the like. And you have testing only when symptoms develop. There's nothing about the brain that's part of an annual or frequent screening within primary care. So the good news is that the message is out. Brain health is mainstream, and it's gaining ground in primary care. This is just one of the many articles that you'll see in publications in the media, like the New York Times here, that pull together the science that we know about how diet, for example, might stave off dementia. And then on the right, you have two publications that were published in the last 2 years. One, a scientific statement from the American Heart Association and the American Academy of Neurology, which outlines a primary care agenda for brain health. And then a major study released by the 3 National Academies of Sciences, Engineering, and Medicine on the crucial role that primary care, high quality primary care, plays in the health of the nation. And so this is the moment, and we are seizing the moment. So our vision is that brain health begins with brain care. So what do we mean by that? Simply what we mean is the answer to the question that we have been getting for a long time. Doctor, how can I take better care of my brain? And I have been receiving this question most frequently from the family members of my patients who have brain disease. Family members who recognize suddenly how devastating brain disease is and want to know what can they do to protect themselves and their loved ones from falling prey to brain disease. And over the years, it became clear that we needed to have very simple, scientifically supported answers to these questions. And so that's why we launched the McCance Clinic, which is where we take care of patients to prevent brain disease and where we study tools, develop tools for brain care. And that's how we came up with our approach to have an impact over the next decade and then the next 30 years. So what is brain care? Our vision of brain care is really what you would see for heart disease. There is an annual brain care assessment. There should be an annual assessment of the health of your brain. And then there ought to be safe drugs and natural products that you can be prescribed that will prevent brain disease and protect brain health if you're deemed to be at high risk for brain disease. And that's the vision that we are working to achieve at the McCance Center. So if you go back to thinking about brain disease, we use this red, yellow, orange, or I should say green, yellow, orange, red color code. If you have brain disease, you're red. And this is right now where we focus all of our care for the brain. It's for people who've already developed symptoms. And we know that that's too late. So we're looking to move the dial back so that instead our focus is on taking people who are in the green category, who have no symptoms of cognitive decline at all, and keeping them there. taking people in the yellow category, and these are people who have high risk for brain disease, giving them medicines to reduce their risk so that they can go from yellow back to green and keeping them there. And then taking people who have the earliest signs of brain disease and stopping its progress and reversing that decline so we get them back into the yellow or even the green zone. We all take care of patients who are already afflicted, but the focus of the McCance Center is right here. This is where we really need to have impact if we're going to change the world's experience of brain disease. We've got to work on prevention. So it turns out that there's already a lot we know that can be harnessed to conduct a brain care assessment. And I'm going to show you now how we do that. So it turns out that up to 40% of dementias can be prevented or delayed for many years. Who knew that? I certainly was shocked when I finally came across all of the epidemiology that supported this. And there have been many very comprehensive reviews in the most respected journals in the world, like The Lancet, that have demonstrated that that's what the evidence shows. Even more strokes are preventable, and up to 38% of depression can be prevented. So let's figure that out now so we can get started on preventing today. This is the basis of the McCance Brain Care Score. The McCance Brain Care Score is a project that we developed in partnership with the patients who came to us in the McCance Clinic seeking an answer to the question, "Doctor, how do I take good care of my brain?" And what we did was we came up with a simple score that took into account all of the best science to answer that question in a way that you could use the score every day to guide your choices in your healthcare. And it's a score made up of physical measures, blood pressure, your blood sugar, your cholesterol, of lifestyle measures, your nutrition, your diet, alcohol, smoking, exercise, and sleep, and then your social, emotional health measures, your stress, your relationship with others, and your sense of meaning in life. And we took these measures and created a score that was designed to motivate patients to get a better score, as good a score as they could get. Over here is the QR code. You'll get everything about the score sent to you. We will be sending you the slides and the information, so don't panic if you can't scan the QR code. And then also, Bridget has put into the chat the web addresses where you can get all this information. So we'll get it to you in lots of different modes, so please don't worry about it now. What I would like instead is for you to focus on, when you have questions, either record them in the chat and Bridget will make sure that I answer them, or just interrupt. I think we can tolerate a little interruption. So, okay, so what goes into this brain score, the brain care score, the physical, lifestyle, and social emotional measures? I'm going to take you through that now. So it turns out that one of the things we've learned over the last decade is how important blood pressure is to brain health. We all know how important blood pressure is to heart health, but it turns out it's even more important for brain health. What that means is the more years that you spend at a normal blood pressure, the lower your risk of stroke, dementia, depression. So there's really no reason not to. It turns out, though, that we're not so good as a country and around the world at controlling blood pressure. Only about half of us in the United States have our blood pressure controlled. So in tandem with launching the Brain Care Score, the McCance Center is also launching a national study to figure out why that's the case and develop approaches that will take us from 50% down to 30%, down to 20%, and ultimately get everybody's blood pressure under control. Blood sugar is another area where we can all work to keep our brain care score high. So this is particularly true for those of us who have diabetes. Control your blood sugar, you reduce your risk of dementia, depression, stroke. Cholesterol as well, and then the BMI, which is a formula that takes into account our height and our weight, and really is an approximation of what our ideal body weight is. The lifestyle measures include diet, and here we're really urging people to keep their fruit and vegetables daily servings relatively high, focus on lean protein as opposed to red meat, whole grains, restrict sodium, and restrict sugar. Alcohol, well, the new alcohol recommendation is no alcohol, which of course is, alcohol is part of a lot of the way we live. And I often work with patients to find ways to gradually reduce alcohol to zero. Cigarette smoking, I think, is self-explanatory. And aerobic exercise and activity, very important. Again, there are lots of ways to achieve it, and I'm happy to talk about that during the Q&A session. And then sleep. Now, when patients come to me for a consultation on their brain care, I would say it is rare for somebody to say that they think they sleep well. Most of us have complaints about our sleep. What I can tell you is there are lots of approaches that I've learned over the years working with both patients and consulting with sleep specialists that I think can really improve a person's sleep. So I think this is an area where we can all find solutions to improve our sleep, but it's a little bit of a personal approach. So I urge you, for those of you who've given up on getting a good night's sleep and are frustrated by it, it's worth talking to your doctor about it and starting to delve into techniques for improving your sleep. And again, I'm happy to talk about that in the Q&A session. Finally, social and emotional measures. There's no question that developing good habits of moderating stress reduces your risk of dementia, stroke, and depression. Maintaining social connections. And when we talk about social connections, we're talking about connections outside of our close families. And this is particularly important for men. We men just tend not to be as good at maintaining social connection as women over the years, and that's something that we at the McCance Center are working on as well. And I think, Highland Meadows is a nice arrangement where you really can, in a structured way, work on maintaining and enhancing social connections. I'm sure you've already discovered that, and you're doing lots of very high impact things to maintain your social connections. Particularly, I heard from Bob and Kathy a little bit about what you did during the pandemic, which is, I'm sure, of high value. And then finally, the question of meaning in life. Meaning in life is what drives us. The way we think of it is all of these, shall we call them social experiences, psychological experiences, have a physiological impact on inflammation in the body and in the brain. So those of us who are able to find meaning and purpose in life by having that experience are reducing the level of inflammation. And so that is a real biological connection between how you feel and your risk of brain disease. So just to show you in numbers a little bit about how this works. Here you have individuals from a study of, in this case, we followed 170,000 people or 166,000 people for development of stroke or dementia over 13 years. And we calculated their brain care score when they started, and they were over the age of 59 when they started. And what you see here is that as the brain care score goes up, your risk of developing dementia goes down, your risk of developing stroke goes down, and to put it more succinctly, every 5-point improvement in your brain care score reduces your risk of dementia by as much as 12% and your risk of stroke by as much as 34%. And here's the message for your children and grandchildren. The earlier you start, the greater the benefit. People who are younger than 50, who get their brain care scores up by 5 points, every 5-point increase reduces their risk of dementia by 50%. That's a major, major impact. So this is really, if everybody were working to achieve their best brain care score, we would see a decline in stroke and dementia rates that would eclipse our goal for 2050. So part of what we're doing is trying to figure out why it is that it's so hard to get people to take good care of their brains and how to fix that. And that's a whole area of medicine called implementation science. And Kathy earlier, when she was introducing me, was talking about how we have to work together, in this case, neuroscientists, psychiatrists, and neurologists. But this gets much more complex than even those three disciplines. We now have to work with healthcare payers. We have to work with behavioral scientists. We have to work with people who have expertise in how to change healthcare systems in order to achieve our vision for reducing the number of new cases of dementia and stroke by 10% in the next 10 years, 30% by 2050. So you can calculate your brain care score. There's a link, again, it'll be distributed to you. You can work with your primary care doctors on the brain care score. And there's lots of more information on our website. So I'm going to now talk about, if only that's all we needed to do. There's still, if you recall, people who are at high risk despite taking good care of their brain. And so what we need to do is monitor those people. So you have to have an annual brain health assessment in the office. So what are we doing to develop that into a reality? Oops. Nope. Sorry. Well, we've got basically 4 major programs at the McCance Center. I've talked to you a little bit about the brain care score. And what's happening next in the brain care score is we're going to be figuring out how to integrate it into electronic medical records, how to refine it in regions where dietary culture is different from the dietary culture that we're most familiar with, translating it into multiple languages, testing it to see how patients react to it, patients from different backgrounds and different settings, both in this country and around the world. And in parallel, we've got a project called the Human Sleep Project, which is devoted to understanding sleep as your fingerprint. So the way I like to talk about sleep is that each of us has a set of characteristics. When we sleep, we're different from the next person, the next person, the next person. So with fancy EEGs, you can measure everybody's sleep fingerprint. And it turns out, as I'll show you in a second, that you can look at the sleep fingerprint and learn a lot about someone's brain health. So we're focused on the Human Sleep Project to understand sleep in just that way. Then, of course, clinical trials. I'll tell you a little bit about the work that Dr. Tanzi has led over the last 30 years, developing a high throughput testing platform in his lab for every single drug that's available on the market and all the natural products that are available on Amazon or elsewhere. And he has systematically evaluated every possible drug in combination to see which might have an impact on slowing or stopping Alzheimer's or other forms of neurodegeneration. And then finally, you need to have a place to store all this data, to share all this data, and to bring together collaborators from around the country and around the world, because we know for sure that we don't have all the answers here at Mass General, at Harvard, in Boston, and we need the best minds, the brightest minds from wherever they might come to join us on this quest to achieve our goals of reducing the number of cases of Alzheimer's by 30% by 2050. So we've built a data science platform where people can come and share their data, work on each other's data, and share their ideas. So just to give you a sense of what the Human Sleep Project is doing, here's an example of a study. We took nearly 11,000 sleep studies. Some of you on this call, on this Zoom conference, may have had sleep studies in the past, but those are studies where you record an EEG of a person while they're sleeping, and that's that fingerprint. And then we've taken from those sleep studies 8,000 participants, identified who had dementia, who went on to have dementia, who went on to have mild cognitive impairment, and who was cognitively normal. And then we looked, these are fancy terms for aspects of the fingerprint, if you will: sleep architecture, frequency bands, spindles, oscillations, coherence. Anyway, what we were working to do was to correlate these features in the EEG with the risk of developing these diagnoses. And we were able to use these features to predict these diagnoses with quite good accuracy, between 73% and 78%. So this is just the first phase. The next phase is to look at tens of thousands, even hundreds of thousands of sleep studies, and start to use machine learning to pull out those features that someday will be part of what we check in our patients and you and my children and us every year to see, how is our brain health? That platform that we build will hold all that sleep data. It's also bringing in blood biomarkers, imaging data, and electronic health records, so we can do more and more research to figure out, again, what is the best annual assessment of brain health. So last, just to give you a sense of how we're proceeding with trying to figure out which drugs to try to test in people. This is how the screening has worked since 2014. In Dr. Tanzi's lab, he screened 3,500 known drugs and natural products using what he calls Alzheimer's in a dish. We've coned them down to about 200 that target the pathology just of Alzheimer's. We figured out how to combine these 200 into unique combinations so they work in different ways on the Alzheimer's pathology. And this year we plan to test up to 12 of these in people for the very first time. So our hope is that someday one of these, two of these, three of these, I don't know how many of these, but at least one will be part of routine care. You'll be prescribed one of these drugs if your brain health assessment suggests that you're in the yellow range and you would benefit from a drug to bring you back to the green range. So here's what you can do today. Start using the Brain Care Score, and I'm happy to talk about that during the Q&A. Learn more about the trials. Some of you may very well want to qualify to participate in the clinical trials if you're interested. You can learn more about what goes on at the McCance Center. And now that you become educated about brain care, become a brain care advocate, talk to your doctor, talk to your family and friends. The Brain Care Score is designed to be simple to use and freely accessible for anybody who wants to take good care of their brain. So what does it take? How did we get here? And what are we going to need to get to our goal? Well, here you have a wonderful representation of our many collaborators. and funders, institutional funders, who have been essential in making this project successful. NIH funds a lot of our research. Foundations fund a lot of our research. Corporate partnerships are important to developing technologies. For example, what's the right technology to assess your sleep fingerprint on an annual basis? But most importantly, we've been the beneficiaries of visionary philanthropy, because visionary philanthropy is what allows us to get started. Visionary philanthropy is what allows us to generate research results that then would make our ideas competitive for federal funding. Because the NIH won't fund ideas that have no evidence to support them yet. They don't fund the best ideas. They fund the ideas that are most likely to succeed. Visionary philanthropy is what you need to fund the best ideas and get them off the ground. And we've been so fortunate with our supporters to be able to take those risks. And I would add, in particular, there are areas, for example, to figure out how to best implement the brain care score in primary care, how best to get doctors and patients to do it every year. That kind of research often will take philanthropic support because it's not quite yet ready for NIH. And we are not willing to wait till the NIH comes around to supporting implementation research, because we have work to do. We aim to get down by 30% by the year 2050. So again, thank you to Kathy and Bob for being a part of this and for supporting this work and allowing us to make really crucial steps forward as we work with patients and work on research and recruit the best talent to our center to achieve our goals.